Right, okay. Welcome everybody online and in person in Oxford to this talk today. It's really fantastic to have Joe Murray here. He's Professor in Epidemiology, the Federal University of Pelotas in Brazil. I think people in our team first met him when he was at Cambridge University in England in the Department of Criminology, where he was working particularly on the effects of parental imprisonment on children's development and antisocial behaviour. And I suppose that kind of got you into longitudinal studies of UK birth cohorts and other data sets. So, you know, becoming a sort of expert in the epidemiology of child and youth conduct problems and antisocial behaviour. So he's really, I suppose, become quite a star in the field of I suppose you might call it the field of developmental epidemiology. How would you call it that, what you do? How things develop across the lifespan using epidemiological methods, but very much a kind of social epidemiology. He works particularly on risk factors for violence and runs the birth cohort study in Pelotas in Brazil. It's a very important example of a birth cohort study in a middle-income country. More recently, he's been doing some interventional studies, including some of home visiting programs where the evaluation of the intervention is embedded within the cohort design, which is a really neat thing to be able to do. And I mean, fantastic if you can then end up with long-term follow-up from interventions. And more recently, he's worked on ran a parenting intervention trial in Brazil. So anyway, he's going to talk about determinants of violence across lives and generations, 4 decades of longitudinal research in Brazil. Thank you. Thank you, Joe.
Thanks a lot, Francis. Thank you all for coming. It's really nice to be here. And thank you for coming in via Teams, those who are on. As Francis said, I got involved in longitudinal research in Cambridge, but actually coming back here to Oxford is coming back. So I did my undergraduate here in philosophy, politics and economics. I've had that before criminology, then working with epidemiological methods. I was in a psychiatry department for a while, so I've had a real mix of disciplines I tried to bring into work that I'm going to show you now in Brazil. So I live in Brazil, have done for 15 years now. And what I'm going to show you today are about these birth cohort studies that we run there, and in which I study violence both as an exposure which children and others experience and the impacts of that through their life course, as well as the developmental determinants of what leads to later violent behaviour. So probably the background a lot of you will know, just about what a major, I kind of look at it mainly as a public health problem violence is, in terms of around 400,000 lives lost to interpersonal violence per year globally, and 32 million injuries that warrant medical care are estimated to occur worldwide each year. So a lot of those acts of violence occur in the community, but within the home environment, around 50% of children are estimated to experience either maltreatment or also outside of the home in terms of bullying or other types of violence, and around 30% of women have had an experience of lifetime intimate partner violence. And I'm going to be talking about 3 main types of violence that experienced by children in the home, women's intimate partner violence, as well as youth violence in the community. So particularly for child maltreatment, and a lot of research has been done on the health impacts of that, as well as injuries, looking at mental health, diseases and non-communicable disease health problems. and risk behaviours. So some of that research has been done traditionally looking very specifically at violence as an exposure. But from 1998, when Felitti and colleagues did a large study with 13,000 adults, I think I mistyped there, of adverse childhood experiences in a more general sense, quite a lot of the work on the impacts on health of violence against children has kind of come under this umbrella. So they were looking at 7 different types of adverse childhood experiences that people might have had. And they asked adults retrospectively about whether they'd experienced any of these 7 events. And then what they did was to associate the number of types of adverse experiences that the adults were reporting back on with their current health behaviours that are linked to the, well, they were looking at the leading causes of death. So, for example, they were showing that the more adverse childhood experiences, or ACEs as they're known, up to 4+, the higher the risk of currently being obese, of smoking, and of having depression. So this classic studies spurned a huge amount of research under this kind of umbrella of ACEs. More adverse experiences were kind of added to this list. And for example, a few years ago, Hillis and colleagues did a systematic review of the link between ACEs and numerous health outcomes. And they looked at, in part, at how a person's adverse childhood experiences linked to later experiences of violence, both as being a victim and perpetrating violence. And you can see there that comparing people who had reported no ACEs to those who reported 4 or more, which is a common comparison made, there's a huge increase in risk both for experiencing violence as a victim and in terms of perpetrating violence across 6 and 9 studies. So I'm going to focus quite a lot on this concept in this talk. In the cohort studies we run, we look at a lot of different aspects of violence, different risk factors, different consequences. But I thought today I'd bring you some recent research we've been doing on ACEs. What we've particularly been trying to think about is the way that this cumulative count of ACEs is a very simple, powerful thing to look at, and clearly carries a lot of risk attached to it. But to some extent, that may be hiding important differences in the effects of individual ACEs or specific clusters of ACEs that people might be exposed to. So, for example, emotional abuse may or may not have larger risk for certain health outcomes compared to divorce, for example. I assume most people are familiar with what a longitudinal or cohort study is, but that's a study that follows the same people through time and measures exposures earlier on and associates them with any kind of outcome. So we may be looking at health, behavior, or really any aspect of human lives that are of interest to us. So here in this talk, we'll be talking about the role of adverse childhood experiences as an exposure that may associate with intimate partner violence, child maltreatment, and also youth perpetration of violence in the community. As Francis said, my main background's in criminology, which looks a lot at youth crime and violence. And a lot of the longitudinal studies on this have been reviewed, and a number of risk factors have been pulled out as quite replicable across different places. However, there's been a major geographical concentration of all those studies looking at longitudinal risk factors for youth crime and violence. So as you can see there, when David Farrington reviewed them in an important book back in 2008, then nearly all, apart from Mauritius, had been conducted in high-income countries. And the massive problem with that is that, as I'm sure many of you know, the highest rates of violence are found elsewhere in the world. So coming from Brazil and in Latin America, this is one of the most violent regions in the world, and interpersonal violence is literally the leading cause of death for young people in that region, and that's true in Brazil. So there's a massive sort of evidence gap where it's needed most. Some years ago, we did a big search to try and check whether there weren't more longitudinal studies that hadn't fit the full criteria that David Farrington had used in these regions. Francis was involved, as well as Julia, who was here. And we did find another I think it was 7 studies in low and middle income countries, and 2 are from Pelotas in Brazil, where I work, and so I'm going to show you about those now. So very briefly, what I'm going to be doing is explaining the methodology of these cohort studies in Pelotas, which I certainly won't take much credit. They've started many years before I arrived there, but they're certainly some of the most important cohort studies in low and middle income countries. And then I'll show you some results from our analyses looking at child maltreatment and intimate partner violence, and how that relates to the mother's own experiences of ACEs in her childhood. And then also I'll be looking at the relationship between ACEs and youth perpetration of violence, as well as some more recent considerations of the wider sort of social legal context in which youth violence takes place in Brazil. So I'll go through this. Feel free to stop me if anything's clear, or you prefer to ask a question while we're going, or also, of course, at the end, I'll be happy to take questions. So Pelotas is a city, medium-sized city of about 340,000 people, right in the southern tip of Brazil there. That's next to Uruguay. And so the south of Brazil is a richer region of the country than the north, but Pelotas city is a relatively poor city for the south. Here are a few pictures to have some sense of where we are there. It has a kind of border on a huge lake that you can't tell isn't the sea, so there's quite a nice kind of beach there. It's quite a historic town, but also it grew to be quite poor. Originally, it was a very rich town from exporting dried meat to Europe mainly, but then when fridges were invented, that changed things. So there's quite a high degree of inequality in Pelotas, and the studies take the entire population of the city who are born in a calendar year and recruit them into a study. So in fact, there are 4 birth cohort studies in Pelotas. The first one was set up in 1982 by Fernando Barros, who came to the London School of Hygiene to do his doctorate and said, I want to look at every child who's born in my hometown and how their health is and the health of their mothers. And Cesar Victor soon joined a year or 2 later to help him try and find those children again, and it turned into this longitudinal study. It was an enormous hit. It became a very important study in child and maternal health, having findings on breastfeeding, for example, that really changed policy in Brazil and in other areas of epidemiology. So another similar study was set up in 1993, doing exactly the same thing, recruiting every child that was born in Pelotas in that calendar year. And basically every 11 years, a new study has been set up with the same methodology. So back to the first one, the way it was done was that a team was of students was placed in each maternity hospital in the city from the 1st of January to the end of December. And the mothers were approached who were giving birth there, and 99% of them agreed to participate in the study. So that gave rise to a study with an initial sample, which is basically the whole population of Pelotas in that year of 5,914. It was then subsequently established that practically everyone is born in hospital in Pelotas. So it really is the entire population that's being studied and has been followed since. This slide gives a map of that study's follow-ups to age 40. Last year was the last follow-up done with the 1982 cohort, and then how each subsequent study has had a similar initial phase and follow-ups afterwards. They've generally had very good follow-up rates for large studies like this. If we think that at age 40, that's 58% were followed up last year. I think if you take a comparable study like ALSPAT, they come down to about 50% in the teenage years. So they're very important, large epidemiological studies with a lot of important findings in the area of health. As well as looking longitudinally, they're set up, of course, in a way that permits analyses of time trends in the city. So each follow-up is done at the same age in the subsequent study using many of the same questionnaires. So you can both look across a life as people grow older in one cohort and compare between cohorts in a really unique way. So there are some deliberately designed accelerated longitudinal studies like this, but and there are the national British cohorts that also permit some time trend analyses. But as far as I know, actually nowhere in the world you had quite such deliberate matching of studies this far apart in time. So my colleagues do all sorts of research that is beyond my kind of real understanding about body composition, physical activity, and many other physical health issues. And I started collaborating in 2010 and moved to Pelotas in 2016 to integrate research on violence. So one of the first things I did was to look at how rates of homicide, which is about the only very reliable data we can get on violence through time in this setting, had changed since the beginning of these studies. And as you can see there, it had shot up enormously from about 1 per 100,000 homicides in the early 1980s, which is roughly what the UK has, to over 30,000 in recent years. So a 30-fold increase during the course of these studies, to the point where the youngest cohort is exposed to the highest rates of serious violence that the city has seen. So within this setup, then we have a number of different projects. So I can only tell you about a small kind of sample of some of the results today, but we look at early parenting practices and psychosocial development. France mentioned we've nested a trial in one of the cohorts. We look at determinants of violence. We compare, particularly with ALSPAC, which is well matched with the 1993 cohort, look at these trends through time and the consequences of conduct and problems and violence in the cohorts as well. So our website, if you're interested in other topics, you can find out about them there. When I joined as faculty in 2016, I decided to focus my time on the youngest cohort because the others had not been set up to look at all of the psychosocial issues around violence that I wanted to study. So now I'm co-directing this youngest cohort and have had the sort of honour and luck to be able to include a lot of really interesting data collection in it. Beyond the socioeconomic conditions that have been evaluated in all of them, have biomarkers like hair cortisol to be able to look at stress getting inside the body. We got a grant from the Bernard Van Leer Foundation to do filmed parent-child interactions with this whole cohort of 4,000. The PIA trial was nested in to evaluate both a book sharing parent training program that's in Parenting for Lifelong Health, as well as ACT, which is another short group-based parenting program from the American Psychological Association. So we have a nested evaluation of those. I won't talk about that today, but if you're interested, let me know. A lot of tests directly with the child, all towards understanding their psychosocial development in this context. So we got up to following these children to age 6 years, and the next assessment will be when they're 11. So some results within this cohort. I'm going to talk about what we know about child maltreatment and intimate partner violence against the mothers in the cohort. So we've found it very useful to kind of consider both violence against children and women in some of the same studies. Alessandra Guedes, some years ago, wrote a really useful kind of conceptual piece about the links between violence against women and children, about how they have shared risk factors, similar social norms that kind of generate both, that they often co-occur in the same households, and have common consequences, as well as having an intergenerational component linked between both. And that's what I'm going to kind of talk most about now. So in this cohort, the 2015 cohort, it's got 4,275 children in it. When the children were aged 4 years, the mothers answered 2 questionnaires, one about her experiences of intimate partner violence in the last 12 months, and another about the children's experience of any type of maltreatment from anyone in their lifetime, so between 0 and 4 years. So the basic prevalence was 23% of mothers reported having experienced any type of intimate partner violence, and reported that 11% of children had experienced some form of maltreatment. Homina is a postdoc who's been analysing these data. She has another article about more kind of concurrent risk factors that link both of these types of violence together. But as I said, what I want to focus on is the question of intergenerational continuity in violence and other adverse experiences. So what Homina did in this paper was to look at data where the mothers reported on their own childhoods as well, and report about different types of adverse childhood experiences they'd had, and then looked at how those associated with current experiences of child maltreatment and intimate partner violence when our cohort members were age 4. So in this population, the mothers were reporting a very high number of experiences of adverse events in their childhood. So I think when I first put up some slides at the beginning about the Felitti study and how the systematic review had done a lot of the contrast made between people who have had none or 4 or more. In fact, we were finding that 25% of the mothers reported 5 or more types of adverse childhood experiences in this population. And so this is just a simple sum count, right, of the number of different types of experiences they've had. That is the common way to analyze in relation to any kind of health outcome. And we can see that when we look at it in that way, we count up the number of ACEs that the mother reported, and we look at the increase in risk that she has for reporting about current intimate partner violence that she's experiencing, then there's a clear, strong gradient in increased risk. So those who had 5 or more ACEs as a child were almost 5 times more likely to also experience intimate partner violence when their child was age 4, now in our current cohort.
Just a quick question on the questionnaire. It was like anonymous, or there was someone intermediating the...
Good question. So so this was done in a confidential interview. So the participants come to our research clinic. So as far as I remember, this questionnaire about the intimate partner violence was only asked in that setting where they were safe from any interference or hearing of anyone else. So because a few of our interviews are done at home, so it wasn't applied there. And when we look at the other outcome of their own children up to age 4 experiencing child maltreatment, we also see a strong expected increase in risk from the number of ACEs that the mother had experienced early on. So again, what a really important question is whether the driving factor around this increase in risk really is just about the cumulative number of any types of ACEs, or whether potentially some ACEs have specific effects that this kind of masks. And that's what Romina was trying to uncover. But this is the prevalence of all the individual types of ACEs that the mothers reported. Again, as you can see, just very high rates of physical abuse, emotional abuse, and having seen one of their household members being treated violently in their childhood. So one way that some people are trying to disentangle possible different effects of different ACEs recently is to apply latent class analysis, which means you're kind of taking a person-centered approach. You're looking at which people have similar clusters of ACEs in their lives. So this was one approach that Romina took. She applied this type of analysis and found 4 different kind of groups of mothers in the population. Some who had very low ACEs, about 38% of the mothers. The high ACE group, 19%, which is actually very similar to that total of 5+ ACEs that we saw in the cumulative count. But then 2 slightly differentiated groups in terms of the primary types of ACEs that they experience. So in one that got called the household dysfunction ACEs group, the mothers had the most prevalent types of ACEs that they'd experienced were parental alcohol and drug use, having one or no parents or parental separation, and also having a household member treated violently. But the other ACEs shown on the right of the graph and shown as in higher bars in the bottom right group, abuse-related ACEs, were more concentrated in that group. So we can then see how the risk for current experiences of violence relates to these different kind of clusterings earlier in life. And this is what we saw, that compared to that low ACE group, the group of mothers who experience high ACEs, kind of across the board, as we might expect, had the highest kind of risk for current violence, both against them and against their child, 4.3 and 5.0. And And then we kind of consider these two slightly different groups, household dysfunction and abuse-related ACEs, and whether there's a different degree of risk for current violence according to those different clusterings. Well, not much, right? For intimate partner violence, the prevalence ratio is almost identical, 2.3 and 2.4. Child maltreatment, it's only just slightly higher and certainly not significantly higher for abuse-related ACEs group. So does this mean that, no, there's not so much specificity? It really is just about the number of ACEs that is important here. We had a bit of doubt, given that although there is some difference between these two groups that emerged, they also had similarity. So in these bars that I've highlighted there, they had quite similar levels of having been separated from parents and having been exposed to violence in their family of origin. And also the abuse-related ACEs, the total number of ACEs just slightly higher as well. So it's quite hard to draw confident conclusions about whether there is or isn't specificity. We found from this type of analysis. So one other type of analysis, which is more simple, but we found informative, was just to look at them individually. Okay, so we just looked at each ACE reported by the mum and its association, first of all, with intimate partner violence. And we try, there's always going to be limitations. We're trying to deal with the fact that ACEs are not independent, they're associated with each other, and to sort of isolate the effect of one ACE in each of these analyses by adjusting for the total number of ACEs that the mother had experienced. So, for example, when Homina analysed where the household member treated violently was associated with later violence, at 1.5 increase in risk. That's adjusting for the cumulative total of other ACEs that the mother had experienced. So what these analyses point to is much more specificity. You can see that for nearly all of the other kinds of ACEs, there's basically no association there, and it's where the mother had been exposed to violence, either witnessing it or experiencing it herself, that she was much greater risk of having intimate partner violence later in life. And the story is quite similar, but less clean, as it were, for child maltreatment. So those are the findings we had relating adverse child experiences to intimate partner violence and child maltreatment. And now I want to talk about another outcome of youth perpetrating violence, and that's mainly looking at perpetration of violence in the community. To look at this, I'm going to be referring to the 1993 Pelotas cohort. And what we did, in fact, it was when I started collaborating with the Pelotas group, the age 18 assessment was just about to happen. And we took a questionnaire that was used in the Ausbach cohort, which is an important birth cohort around Bristol that started in 1991 to 92, and had applied at age 18 a self-report crime questionnaire at that age. And so we took it to Pelotas, we piloted it, etc., and then put it in at the age 18 assessment there. And actually, there are a number of different measures prior to age 18, like child behaviour on the strengths and difficulties questionnaire, that are well matched between these cohorts. So we get to do quite a lot of interesting cross-national comparisons. It's not what I'm going to focus on now, but just to show you in terms of the outcome that had been based on this questionnaire for Ausbach. In Ausbach, at age 18, 11% of the males and 3% of the females self-reported in a confidential questionnaire having behaved, I think there were 4 different violent acts of hitting someone with the intention to hurt, a robbery involving violence, carrying or using a weapon. And then when we applied that in Pelotas and compared, so there was a lot more self-reported violence in Pelotas and Ausbach. Interestingly, there was actually less non-violent crime in Pelotas, but these rates of violence match well with what we know from official records that show a lot of violence in Brazil. So that's the kind of outcome that we're looking at. Okay, self-reported violence in late adolescence in Pelotas. And what, yes, please. Sorry, can you hear?
The cohort in Bristol,
yeah.
is it representative sample?
Yeah, it's a good question. It's it recruited 14,000 people at baseline, and honestly, it's not super clear. It wasn't like a total population sample. They've had a lot more attrition in Ausbach. So any kind of analyses, and we did that here, need to be kind of weighted to try to represent the actual population as best as possible. So to try and kind of keep a theme going, I'm going to show you results that another postdoc, Andreas Bauer, has been doing analyses on ACEs experienced by the youth in Pelotas and their self-reported violence in late adolescence. So in this 1993 cohort, the youth primarily self-reported their ACEs at age 15. Okay, so they're giving their accounts of what their childhood had been like up to that point in time. And as I say, the ACEs literature has kind of grown and considered that other types of adversity should be considered as well. And so Andreas added 3 more types onto the list compared to that 2015 cohort analyses, which are listed there in bold. The percentages are quite a bit lower than the mums reported in the 2015 cohort, if you notice, which is probably a mixture of a few reasons. First, I think it's probably true, total kind of adversity in the population has diminished through time in Pelotas. We're looking at a younger cohort here. Second, this is males and females. Remember, the other cohort was just mothers. And also, I think particularly the instrument here is an adapted childhood trauma questionnaire, which cut quite short for a large epidemiological study when this was applied. And I think that probably reduces the prevalence rates here. Nonetheless,
Some of the things haven't happened yet.
Sorry?
Some of the things haven't happened yet because they're younger than the mothers, right?
Yeah, and the age, yeah. I mean, the mothers were retrospectively reporting up to age 18, and this is up to age 15. Yeah.
Do they self-report poverty? Or
No, yeah. So most of this is self-report. Poverty isn't. The mum reported on neighbourhood insecurity. Yeah, so it's a mix. Yeah, that's true. So there are a number of differences which could explain different prevalence rates. But so that's not what I've focused on. It's more about the associations with the violence outcomes. So again, Andreas took these different approaches of trying to think, oh dear, I thought I had, you can take it from me that the cumulative number of ACEs predicts youth violence perpetration as one would expect. And then we get into, well, is there any specificity again, either by kind of group or otherwise? So he also did latent class analyses looking at the different clusters of ACEs that these youth had been exposed to, and found a low ACE group, an ACE group that he referred to as maltreatment and household problems principally. So on the left there in the box are the items on maltreatment, that's physical neglect, physical abuse, emotional abuse, and sexual abuse. Oh, and as well as witnessing domestic violence. So you can see that that group in the middle was exposed to those types of difficulties in the way that the group on the right, called household problems and social risks, had much lower rates of. Yeah.
So in the previous slides, it was household member treated violently, and then this one has domestic violence. Is there a difference between?
That's a good question. I'd have to go back and look at the actual item. I would guess yes. So this, again, this was applied at age 15 from the childhood trauma questionnaire. And I can't remember the literal question on that. And the other one was a different WHO questionnaire, but yeah, I could come back to you with the detail if you want. Okay, so we have these three groups, some difference there. And then this is how those latent classes relate to whether the youth themselves self-report perpetrating violence later on. And you can see that both of the kind of ACE groups have heightened risk for youth violence, but there is a larger effect size for this group who had experienced child maltreatment as well as household challenges earlier on. Again, it's difficult to draw a firm conclusion. There's some specificity there. I'm just eyeballing it. You can see this middle group probably has a larger total number of ACEs than the group on the right. So again, is it about the effects of this specific type of ACE, or is it just a slightly larger number that's explaining that higher odds ratio here? So although these latent classes analyses are nice, they give a picture of the kinds of things people experience at the same time or throughout their childhoods and the clustering of that. We've not always found that it's given the cleanest answer on specificity. So again, he's gone on to look at just each one individually. This is presented graphically slightly differently here. They're not odds ratios, they're just the percentage of people who reported violence, this time at age 22, according to whether they were exposed in that top row to physical abuse, 14.9% versus those who were unexposed. So you can see at this individual ACE level, the highest difference in risk between those exposed and unexposed were for the main types of abuse and neglect that were measured in this study. And that carried forward through when he did kind of logistic regression and adjusting for total numbers of ACEs again. So overall, that's the kind of, we're getting a picture that certainly cumulative ACEs is important, but there does seem some specificity in terms of exposure to violence early on in terms of predicting later violence.
Parental death the other way around.
Sorry?
Is parental death the other way around?
Yeah.
Are you coming on to that?
Sorry?
Are you coming on to that?
No. So when you mentioned, during my PhD, I'd done quite a lot on parent-child separations of different types and links to later antisocial behaviour. So I'd focused on parental imprisonment, which is a type of a separation that has strong effects. But I remember at that time seeing that divorce was quite commonly a kind of risk factor as well, but death didn't tend to carry much sort of psychosocial risk in the studies I was looking at there.
What we might do in this context, because one of the causes of parent death is, is community and domestic violence, and and not having any healthcare and stuff like that, and poverty. perhaps more than it is in, say, the UK studies that found the same. Well, they found no risk. I mean, is that actually a lower risk, or is it just a non-significant difference between exposure and not?
France, yeah.
That's, obviously that's been found in UK cohort studies that parental death doesn't carry the same risk as these other things.
Yeah, to be honest, that's what the kind of interpretation
significant or not. I thought that it might be slightly different picture here about what the other concomitants of parental death in this context, but obviously not.
So not that, but whether it actually carries lower risk. You're right, we should dig in to check, because it would be, I can't think of a plausible reason why it would have, genuinely causal effect in lowering risk. But we'll have to think more about that.
We should go back to simple size. If the prevalence of parental death is very low, this is maybe a really
let's check that. I haven't. Perhaps that's 7%. Yeah, so it's less reliable.
It's bigger than some of the others.
Okay, so I wanted to finish by kind of some of the more recent thinking we're doing about youth violence. As I say, there are lots of other individual psychological factors, other social factors, and so on that we're studying. But in particular, I wanted to draw attention to the social and legal context of youth violence in Brazil, where Brazil has had one of the highest rates of inequality in the world over a number of years. It varies, but it tends to be very high. There's a huge problem of gangs and drugs trafficking that drives a lot of the violence that occurs. So I'm sort of learning this more and more myself from sociologists who study the kind of patterns of violence in Brazil, but literally billions of dollars of international drugs come through Brazil. So mainly cocaine coming from other countries, not produced in Brazil, coming through Brazil and coming to Europe for recreational use is just a market that sucks in illegal drug traffickers and causes violence and territorial disputes over that huge wealth in the context of otherwise experiencing poverty. As I'm talking about youth violence, which kills a hell of a lot of people in Brazil, but the police abuse of violence is incredible in Brazil. So around 5,000 killings in 2019. That's actually a rate of, I mentioned, 1 per 100,000 murders a year in the UK, roughly. It's about what the police do in Brazil. There's a terrible overcrowding problem of prisoners, a lot being held on pre-trial, where a lot of organized crime develops. So it's been really impressive for me that the kind of traditional longitudinal research was doing mainly on family processes in relation to violence was just missing a huge part of the picture of what was going on. And so we're trying to build in what we can to our individual level studies now to think more about this. So, for example, Amy Nivette, who was at Oxford for a while, suggested a kind of model of thinking about this larger macro picture and the question of legitimacy of state institutions that are abusing their power and how that affects individual at the individual level, people's perceptions of the society and the state institutions that they're living in, and may contribute to their own violence or other actions which then have a kind of feedback into institutional breakdown with a kind of vicious cycle going on. So in another of the cohorts, when the 2004 cohort, when the participants were aged 15, we managed to include 3 short questionnaires, asked the adolescents about their perceptions of the police, the law, the legal system in Brazil, and the social system, and basically whether they thought they were fair, whether police acted as they should, abuse power or not. And the question that Andreas was addressing is, how does this relate to, again, perpetration of violence using the same questionnaire as just showed in the 93 cohort? And the answer, and this is adjusting for a lot of background kind of individual and family factors from childhood, was that principally in relation to the police, there was a strong association between perceiving the police to being a very illegitimate force of control and abuse of power, and then the adolescent's own violent behaviour several years later. So with their perceptions of law and social system, there was no significant kind of main effect, but it's still currently doing analyses that looks at that in a more complicated way. So if we take the adolescent's perception of the law and the effect on their own violence, but we stratify this effect considering something else about how the adolescents perceive the legal system, and that is how effective it is. How likely, if you commit a crime, are you to be punished? Because this is another major problem in Brazil, that actually, although there's a major problem of crime and police abuse power, actually very few crimes end up going through the courts, etc. So amongst those who think that you've got a high risk of punishment if you commit crime, there really is no effect of your perceptions of how legitimate the legal system is. You can see the odds ratio is 1.1 there, next to no effect. But interestingly, then, when you say stratify by how much the adolescent thinks that you're likely to be punished if you commit a crime, for those who don't think you're likely to be punished, this perception of the legal system really matters. So there's an increase in risk of committing violence for those who perceive the law to be illegitimate if they think the law also is ineffective. So there's a complex story there that we're just beginning to sort of investigate, but I just wanted to draw attention to just some of the other work we're doing on youth violence, given that, as I say, I think a lot of the work on risk factors for youth violence has come from high-income countries where a lot of the kind of wider state social context is less considered, and there's been more replicable results shown about individual and family factors that are involved. But I think, at least in this context, it's critical to consider this wider context. So overall, we have a picture from these results of the importance of adverse childhood experiences for all the types of violence that I mentioned: childhood maltreatment, intimate partner violence, youth violence, with a clear sense that cumulative exposure is important, as that kind of field of research focuses on, but some indication of some specificity and effects as well of some types of ACEs, particularly those of maltreatment, and this legal and social context being important to take into account for youth violence as well. So that's kind of where I'm wanting our group to kind of go towards more now. Obviously, we need to take a ecological model towards understanding violence, but we're now, as well as asking about perceptions of the kind of macro context, the other thing we're aiming to do, well, we're currently doing, is mapping the whole city and looking where people live, where they're going, and so we ideally can have this sort of macro to micro view of all the processes involved. So thanks very much for your time, and that's just to acknowledge lots of teams involved and funders and so on. Thank you.
Joe, now we've got time for questions from online and from in the room. Maybe we'll alternate. Can you see questions online at the moment, Alex? Great.
Yes, we have.
Because now there's probably about 20 people online. So should we take questions alternating between them, and then anyone in person, we're going to the pub, to the White Rabbit after we finish the questions. So you're all very welcome. Do you mind fielding questions?
Okay,
and then,
sure.
And then Alex will say now an online.
Okay.
Please. Okay. It's right. Okay. I have actually two questions. The first one is whether you looked at race to understand if different children with different races have different outcomes, because I know that this is a major social issue in the south of the country. And another thing, what is if you got to isolate the effect of the family, like families who have a poor social environment, but they have a good family structure. What is the power of having a good family structure in the outcomes, even with a bad social environment?
Yeah, great question. So, I don't have the kind of results on the race. Our whole epidemiology group does a lot of work on inequalities in health outcomes in relation both to kind of different socioeconomic factors and race, and it's called the Equity Centre there that shows a lot of deep health inequalities. So in relation to violence, we haven't been analysing that so far. It's quite often come up, should we include it in this paper? But I felt that particularly when you're dealing with violence, it would require such a careful specific look at that issue that it hasn't entered into the kind of analyses we've done today. And it's a great question whether the family processes might basically buffer against some of the social context difficulties. And that was really the motivation for looking at, we've now evaluated 3 different programs, parenting programs. One that Franz mentioned, there's a home visiting program that's actually very large scale across the whole state. And so we've run a quasi-experimental study looking at whether support to vulnerable families that's given in that towards parenting supports better child development. And there are some small beneficial effects, as well as these 2 parenting programs that we've evaluated in a trial. And there was some benefits for parenting, but so far we haven't seen benefits for children themselves.
Thank you.
Maybe we can go to an online question. Amelina has had her hand up for a while. If Amelina, you want.
Hello, hi. Can you hear me?
Yes. Hi.
All right. Hi. I'm from Malaysia. It's actually 1 a.m. here. I just traveled back for a term break. But this is a very interesting presentation, and this is actually something that I've been working on for a while. So I basically have a question. Based on the longitudinal study, how did you map out the social norms or the behavioral drivers of violence? Because I noticed in the earlier slide, you actually mentioned that one of the things that perpetuate violence or exacerbate violence is actually social norms. So based on the longitudinal study, how did you sort of assess that? And then was there any particular region or community with higher prevalence of violence due to the social norm factor? Over from my side. Thank you.
Thank you. So I found it hard to hear if anyone can help. So
she was asking about social norms, and did you factor that into your analysis?
Was it
so,
in one of the earlier slides, social norms is highlighted as one of the factors for risk and perpetration of violence. So did you factor in social community norms around violence?
Yeah.
Gender inequality more generally? Into your analysis?
Yeah. So we've in these analyses, social norms weren't included. We have mainly been measuring about parental attitudes towards use of violence with children, but those data aren't yet analysed, so I hope I can come back and present those another time. But clearly, yeah, as I say, violence is hugely complex with all these layers, and certainly don't. Yeah, social norms are considered fundamental to understanding the phenomena as well. Yeah.
Thanks, Joe. So I just want to understand a little bit more about pathways towards violence. So I can kind of imagine the pathway from adverse childhood experiences towards youth violence, towards perpetration of violence by youth. So, you have adverse childhood experiences, might lead to some problems, and those problems might be associated with violence. What I'm confused about is the relationship between adverse childhood experiences and being a victim of intimate partner violence. Mm-hmm. So what I'm wondering is are the conclusions that are being made that their adverse childhood experiences associated with, maybe some social problems, for example, and those same social problems persist because maybe you live in the same area, mm-hmm. and those social problems are also associated with someone perpetrating violence against you. Mm-hmm. Because presumably the conclusion's not being a victim of adverse childhood experiences produces something within you that makes you more likely to be a victim of violence because of something internal. I'm asking whether the conclusion is that there are external things that are associated.
Mm-hmm. So we don't know. It's an empirical question that we haven't tested yet. The different, from what I know of the literature, the different kind of hypotheses about these effects are both of what you're talking about. So there's possible continuity in social adversity that it's reflecting, or also effects of the experience of being a victim of violence in terms of the types of relationship that one may get involved in later on may be affected by that towards more antisocial partners.
Interesting.
Those are just hypotheses that I've seen in the literature, but that we didn't test. The kind of current factors that we saw associated with both intimate partner violence and maltreatment were living in a violent neighbourhood. So that kind of speaks to that continuity in that context, and then particularly whether the biological father was absent, and whether there was a kind of so because it's more often a social father being present that's related to those outcomes, and the father's general antisocial behaviour. Those concurrent risk factors for experiencing intimate partner violence and child maltreatment speak to both possible types of mechanisms, but it's not something we've tested.
I have a question related to the first study you reported. You show a very interesting picture about the change for homosex.
Sorry, change of?
Homosex, right?
Homicide.
Yeah, the trends in homicide.
Yeah. We might show that picture again.
You want to see it?
Yeah.
It's shocking. There's been no drop off like in lots of other countries. Then it looks like from that.
So I do need to update it. That went to 2020. So you can see it's just flattening slightly. Oh, is it not gone there? Okay.
Presentation ended and then
it's actually gone down for the last few years, and it has nationally. It's not. So our local government is very happy because they implemented a violence reduction package in 2017, and things have been going down since then.
What's the violence reduction?
Well, I say package. Okay, so it's called Pactul Pelotas, and it's really interesting. It's a municipal government, the mayor actually is from our university and decided, okay, I'm going to make reducing violence in our town a kind of key priority, which is not normally done. It's normally considered a state or federal level problem. And she was saying, okay, I'm going to try and be evidence-based, and got in some consultants who came up with kind of primary, secondary, tertiary interventions, which included so when I said we've done this trial of the parenting programs, that was in collaboration with the local government, where they thought, okay, these are promising programs that we'd like to scale up. I said, okay, let's do it, but have an evaluation go on at the same time. But so they've worked across health, education, and justice in really interesting ways. I think they claimed that it's reduced violence more than the intervention itself has, but I think it has helped.
But you said that but violence is going down nationally, so
yeah, exactly. So they just do before-after figures that look amazing. We've done a sort of synthetic control evaluation that it was still positive, but not quite.
Were you comparing with other states?
No, we were doing synthetic control within our state to all the other cities.
But if it goes down a similar amount in other states, then it's not, unless they're all doing the same thing.
Well, there's variation between states, so it felt important for our control to be in our state. Yeah.
No, I just think it's so easy for governments to say, look, we did this and it went down.
Yeah.
When often the national trends are often doing the same.
Yes,
a lot
quite.
Of political capital's been made out of that.
Yes. So I am publicly in favour of what they're doing, and it has helped.
Good.
But yeah.
But is it?
So you see a slight flattening, dropping there, but actually it's gone quite.
You have flattening. You've got drops here and flattenings there.
Yeah, but it's carried on to, as I say, I should update this. 2023, it's probably around here, about 22. It's gone down to about 22 per 100,000 now. Still way too high, but
shocking, isn't it? Because that's one per 100,000. That's the rate in many Western European countries, and the rate that you make, the shocking rate that you mentioned of police killings is there.
Exactly. Yeah.
Yeah. Right.
There were a few questions online from Ellen. I don't know if you wanted to unmute.
Okay.
Sure. Can you guys hear me all right?
I think we just have one question about this slide, and then we'll come to you online.
Okay. Perfect.
It's 30 per 100,000.
Correct. But not for this outcome. I mean, it's a small number, but that's about 100 people being killed in the city per year. Yeah.
My question is, if we look at that outcome variable, the odds ratio is the effect size you use.
Yeah.
Maybe it's not that sensitive to reflect.
Yeah, it's correct. And that's why also you're seeing such variation going on, because it's a rare event, homicide. But that's not what we're studying in the cohorts. We study much more common non-lethal violence, where you had, for example, 23% of males self-reporting committing a non-lethal violent act in the last year. So that yeah. Although I will just say, in our 1982 cohort, I considered presenting it. We've collected the records, and we've identified 55 homicide offenders up to age 30, and we've been doing analyses on what determines homicide, representing, to my knowledge, only the second cohort in the world that's done that after the Pittsburgh study. So there are enough homicides, sort of, unfortunately, to do some analyses that give quite useful results.
The risk factors
for homicide.
Not victimisation.
Yeah, at the moment we're looking at perpetration, and then we will look at them together. Yeah.
No, it's a good measure, because compared to other measures of violence across the world, it's more reliable, even though it's not perfect. It's homicide rates.
Yeah. So sorry, I cut someone off online.
Hi, yeah, thanks for a great presentation. I just had a few quick clarification questions. I noticed at the end that it looks like there was some collection of biological measures of stress within the cohort. And I just wondered if there was any sort of genetic data, like information on any polymorphisms for mental health risk, et cetera.
There are, yeah, so all the cohorts have collected the material for genetic analyses. The oldest 3 cohorts already have that in GWAS form. And 2015, great. I'm waiting for a collaborator to come with money to transform it into GWAS. Yeah, so we had that with hair cortisol repeatedly taken as well.
Great. So that leads me to my next question, which was, it looks like from your last slide, the main funders of the cohort were Wellcome, Botner, and Bernard Van Leer, I think. Are there any Brazilian funders, either sort of philanthropies or government?
Yeah, so those are ones that finance my research, Wellcome, Botner, and Bernard Van Leer, on violence and parenting. Okay. Wellcome has also generally funded the cohorts in earlier phases. Recently, most of the funding for the follow-ups has come from the Brazilian government itself, last sort of 5-6 years. Yeah.
Okay, great. And sorry, one last one, if that's okay. I was curious about the measure of discrimination, if it was sort of a generic one or if it's specifically race or class-based questions.
Yeah, it's not a great measure. It was a measure which did distinguish, have you experienced discrimination by different kind of causes, but it had been as far as I remember, it had been kind of made up by the team, and the prevalence rates were very low, and it's not great data, in my opinion. So on what you saw, they were lumped into one. Unfortunately, obviously, that hides a lot of very important differences, and we should have better questionnaires to get at that.
Great, thank you so much.
Thanks. Yeah.
Quick question. I was also curious in terms of measures. I think the connection between these kind of macro situations, especially with regard to like state legitimacy or illegitimacy and interpersonal violence, are really interesting. And I was curious, firstly, just how you measured that perception, and then also you started to show the kind of theorizing you're doing around how these kind of the macro to micro factors, and if you've thought through how, even just at a hypothesis level, like how that might affect household level violence, like intimate partner violence.
My household level. Yeah. So on the measures, we basically just took, there's a whole field of research on legitimacy, police legitimacy, and we went to the main international studies that have quite short 4 or 5 item questions about that, which we felt worked in our context, and use those. I can send you the details if you'd like. Yeah, so I think we probably need to think of kind of 2 main ways through which that kind of macro setting gets through to individual behavior. One is, the individual perceptions of it, which is what I was showing, but then how it impacts on community. So I think that's perhaps where it may affect household level violence more in terms. So if you have, state failure, which you do in a lot of the very poor communities who don't receive basic services, who live under hugely stressful conditions, then via that, household stress and violence emerges. So that's why I say the next step is this mapping, trying to see that community context, measure that better. Okay, so I think if we have no more online, good to go. No?
I want to ask you about the parenting interventions, but maybe we should do that in the pub.
Okay, thank you. Thank you.